5 minutes.
Without objection, so ordered.
Thank you, Mr. Speaker. You know, this body passed a cap and trade bill, and we had people coming down, friends across the other side of the aisle, saying, this isn't going to cost jobs, it's going to create jobs. Well, they telegraphed every time that was said that they had not read the bill. They assured Americans this is going to create green jobs. It ain't going to cost jobs. But if they bothered to read the bill, they would have seen that before the 300 pages were added and unaffected by the 300 pages was a fund created to pay an allowance to people who lost their jobs because of the bill. It also created a fund that could help them with relocation after they lost their job because of the bill. So they just hadn't read the bill, so they were able to come down and in righteous indignation say it wasn't going to cost jobs, just because I knew they were being honest. They just were ignorant about what the bill said. But it will cost jobs. And now we're told that some of us don't care about seniors. Mr. Speaker, I'm here because I care about seniors, and I know what that health care bill is going to do to them. It is going to put seniors on lists to get treatment for those who are not considered too old to put on lists. And if you followed the President's own presentation on that town hall when he was asked by Ms. Pam Sturm, you know, she pointed out my mother was 100 nearly, and she needed a pacemaker. And her doctor said because of the joy and quality of her life, she should have one. But the arrhythmia specialist said, no, not somebody her age, until he met her. And he said, well, of course, she needs to have one. And so they did, and she's now 105. So when Ms. Sturm asked the President, you know, is there any consideration to be given for a certain spirit, joy of living, quality of life, or is it just a medical cutoff? He went into a long explanation and ended by saying, you know what, we at least can let your mom know that, you know what, maybe this isn't going to help. Maybe you're better off not having the surgery, but taking a painkiller. Taking a painkiller. When she had, we've already seen she had another 5 years, and the President wants to say, well, maybe we just give her a painkiller and let her die. This is going to allow seniors to die that could have a much more ongoing productive life. There is no reason to do this. Now, when I had my staff, and I look at this, with the latest numbers we were able to get were for 2007. 112 million households roughly in America. You divide that into the amount of money paid for Medicare and Medicaid, $9,200 per household for every household in America. Well, once I saw that, I realized, boy, there is a way for the first time in 40-something years to give seniors control over their own health care and their own life. You give them $3,500 in their own health savings account that they control. Give them a debit card. They have exclusive control. No insurance company can tell them what to do with it. And then you buy them private insurance, and they won't have to do like my mother-in-law and buy supplemental insurance on top of that. Others buying wraparound. You buy them good insurance. They don't need to do that. And on top of that, you save the country hundreds of billions of dollars a year. Now, that puts control in seniors' hands, and it saves the country money. But this isn't about that. It is about control. This health care bill is about control. It's about taking charge of people's lives. Now, we've had the EPA already say, since carbon dioxide is a pollutant, this body has the right to control any entity that puts out carbon dioxide. Well, maybe there are people here in the majority that can pick out individuals that say, you know what, I'm tired of them putting out carbon dioxide. It's time for them to stop. I mean, that's how ludicrous it gets, except that once you can control whether people put out carbon dioxide, you can control where they live or not. Once you can control their health care, you can have the right to say, you know what? I noticed in your credit card purchase you bought some Twinkies last month, and therefore we're not going to provide health care unless you quit buying those. I mean, this is going to get so intrusive. The one thing that's clear is that Orwell was 25 years early, because this is going to be so Orwellian, with Big Brother looking into everyone's lives and having the right to do so once they pay for your health care. This will allow seniors to die waiting in line for lists. You think that's over the top? I had a Canadian man tell me that just a few weeks ago. His dad got put on the list for a bypass surgery. He had to wait 2 years. And I said, why did it take so long? He said, well, the bureaucrats kept moving him back. Let's don't kill our seniors. Let's give them control. That's what Americans should do. I yield back.